Good afternoon, everyone, and thank you for joining us. I'm going to turn it over to our Carolina Hunger Initiative Director, Lou Ann Crumpler, to get us started.
Well, hello, everyone, and thank you so much for being with us. I'm Director of the Carolina Hunger Initiative at the University of North Carolina at Chapel Hill. We're so glad that you decided to be with us today. Together with my colleagues at UNC, we work on projects for No Kid Hungry North Carolina and for the Carolina Hunger Initiative. Now I'm happy to introduce Tamara Baker, who is Project and Communications Director for the team. Tamara will be leading our discussion today. Thank you so much, Tamara.
Thank you for having me. We're so honored to be here and to talk with you today. The Carolina Hunger Initiative is also the same organization as No Kid Hungry North Carolina. It's a partnership. We're both based at University of North Carolina at the UNC Center for Health Promotion and Disease Prevention. And we're honored to be here with you today and put a special highlight on North Carolina. The White House has called for partners and organizations, including anti-hunger and nutrition advocates, to host their own events following the landmark September 28, 2022 White House Conference on Hunger, Nutrition, and Health. The purpose of such events is to increase awareness and hopefully inspire action to end hunger, improve nutrition, and reduce the disparities that Americans face. The topics covered by the White House Conference and the national strategy released in conjunction with the convening are very broad. But our event today brings together voices from across North Carolina to amplify what we heard at the White House Conference. But our more specific goal is to provide a snapshot of child nutrition, including in our public schools in North Carolina. You will hear about policies, prospects, and possibilities. We thank you for joining us. But first, let's give a quick overview of what we're going to be discussing and who you're going to hear from. Today, we hear from someone who, in the words of my favorite hit Broadway show, Hamilton, was in the room where it happened. Can't wait to hear. She attended in person while many thousands of us streamlined the event or watched on recordings later, which you can still watch on recordings. You will also hear highlights from the conference and a summary of the national strategy. But how is child nutrition in North Carolina impacted? Well, Dr. Lynn Harvey with the North Carolina Department of Public Instruction is going to provide insight and updates on the federal assistance programs and a current picture of just how they are or are not working well in North Carolina. Then we'll hear about a new campaign in North Carolina called School Meals for All, which is really exciting. And finally, we're going to share some action steps that you can take for our children. But first, let's get started with a few video excerpts from the White House Conference that have been pulled together so graciously from our video producer and our conference organizer, Dr. Andrew Harrell, who we're glad is working behind the scenes with us today, and you'll be hearing from him as well. Andrew, let it go.
Just look at how far we've come on child poverty. 30 years ago, as was referenced, 1 in 4 children live below the poverty line. Today, 1 in 20 live below the poverty line. So I know we can tackle hunger as well. And I've released a national strategy to meet that bold goal. The strategy that has three key principles. First, help more Americans. Say this again, help more Americans access the food that will keep their families nourished and healthy. A lot of food deserts out there. Second, give folks the option and information they need to make healthy dietary choices. Thirdly, help more Americans be physically active. In the next 10 years, my plan, as was already referenced, would make at least 9 million more children eligible for free school meals, a major first step for free meals for every single student. And we're also supporting schools so they can cook more meals from scratch, purchase more food from local farmers and ranchers. And this will mean kids will have healthier meals and will strengthen rural economies at the same time. But there's always significantly more we can do. That's why we're here today, to harness our greatest resource, our fellow Americans. Everyone has an important role to play. Local, state, territory, and tribal governments, and the federal government as well. The private sector, civil society, agriculture, philanthropy, academia.
The first White House Conference on Food and Nutrition more than 50 years ago made significant progress towards reducing food insecurity. Today, USDA runs nutrition assistance programs that serve 1 in 4 Americans every year. However, food and nutrition insecurity still remains unacceptably high. Recent research demonstrates that school meals provide the healthiest food a child eats during the day. The proposal reorients this important program as a key health tool to provide the highest quality meals and to engage children around healthy choices. And we also increase access to local and regional foods, enabling more schools to cook meals from scratch by funding training and equipment purchases, investing in robust school nutrition workforce, and expanding nutrition education for our children.
Thank you for sharing that, Andrew. Next, we're going to hear from Mary Oxendine. She joined the Durham County government as the first county food security coordinator in April of 2021. Mary is Native American, a member of the Lumbee and Tuscarora tribes, and grew up on the contemporary lands of the Lumbee tribe in Robeson County, North Carolina. She earned a BA in public policy from where we are, UNC Chapel Hill, and a Master of Science in Nutrition at Meredith College. She's recognized as a key food system leader in Durham and was invited to the White House Conference on Hunger, Nutrition, and Health to be in person based on her many connections in food insecurity. Now, Mary.
Thanks, Tamara. Before jumping in, thanks so much for inviting me to be here today. I appreciate it. And part of the reason why I was invited to the White House Conference is my role in Durham, but also having lived experience with food insecurity. I did grow up in a home where we did frequent the food pantry and were on SNAP and Medicaid and all the government assistance programs. So this topic is definitely near and dear to my heart, and not just a sort of an academic pursuit. So I've been asked to just give you an insider's perspective, so to speak, on what it was like at the White House. But I'll spend just a few minutes talking about why this conference was so important. You can go to the next slide, Andrew. So this conference was held on September 28th. This was the first time that, or I guess the first time a conference like this had been done in 50 years. There was the first and only White House Conference on Food, Nutrition, and Health in 1969. And from that conference, there were huge changes that resulted in school lunches, the creation of the WIC program, and other changes, including how we label food. So there's a lot of kind of pressure, so to speak, on this 2022 conference on, what might be able to come out of this conference. And so the purpose of this year was really to, again, rally public and private entities around that national strategy that came out the day before the conference. And we'll talk a little bit about that in just a few minutes. You can go to the next slide. Before going into the details of the national strategy, I want to just share some photos, and these may not be the highest quality. I took them on my phone, but I think we have a little snippet to share from President Biden's speech from the conference. Andrew, if you want to play that.
Sorry, Mary, we're going to keep going past that. I apologize.
Oh, no worries. Yeah, so this photo is President Biden whenever he was speaking. You did see him earlier, and then you can go to the next slide. and as part of the first opening session, there was a plenary, but before the panel spoke, sorry, we had a kind of an opening remarks from co-founder of Equitable Spaces. Her name is Jamaica Mills, and she's in the top right corner. And then also earlier you saw Secretary Tom Vilsack from the U.S. Agriculture Department. And in the left, you see Senator Cory Booker, U.S. Senator Mike Braun, and Ambassador Susan Rice, as well as Congressman James McGovern. And I think the folks that are on the left were really some of the folks that kind of preempted getting this conference started and really kind of spearheading the work that went into this. Next slide. And so the next slide you can just see is kind of some selfies and some other folks that were able to join me at the conference. So on the left, it's myself and Cameron Smith. She's the Executive Director of Communities and Partnership, which is a majority Black women-led nonprofit engaged in food system work in Durham. And so Cameron was also invited to the conference. And so we kind of hung out together there. In the center is Cameron, as well as Tambra Ray Stevenson. She's the founder and CEO of an organization called WANDA. It's Women Advancing Nutrition, Dietetics, and Agriculture, as well as Mary Blackford, the founder of Market 7, who was one of the panel speakers. And then that's just me on the end. You can go to the next slide. So thinking about the national strategy, again, that was released the day before the conference, but I want to take a moment to highlight one of the diagrams, or the diagram that was included in the report, that really kind of focuses on why this conference and this national strategy is needed. We do talk a lot about food insecurity and equity, but I really like this diagram in that it really does kind of pull together all the big picture items. So thinking about overall health, decreased academic achievement, increased financial stress, poor mental health, whenever you think about individual costs, but also thinking about societal costs and reduced workforce productivity, reduced military readiness, and increased healthcare costs. So even though, individually you may not be food insecure, our society as a whole is bearing the brunt of folks that are food insecure and are facing nutritional health challenges due to, in food insecurity or poor eating. Next slide. So I just wanted to really quickly kind of go over each of the pillars. So there's 5 pillars total. The first one is really focused on food access and affordability. This one is really focused on individuals experiencing food insecurity and ways that the federal government can support people accessing federal assistance programs. The strategies highlighted really focus on investing in community and economic development to increase access to food. Most of the time, particularly in the United States, it's not about availability of food. It's, do folks have the economic means to be able to afford healthy foods? The second pillar is focused on integrating nutrition and health. So really thinking about how do we work with healthcare organizations and other entities to really, think about nutrition and food as medicine. So nutrition strategies to prevent and manage disease, connecting folks that are food insecure to the different services that they need, but also strengthening and diversifying the nutrition workforce, providing nutrition education for physicians, integrating dietitians more into the workforce. And the third pillar on this slide is empower all consumers to make and have access to healthy choices. So this is really thinking about consumer and food labeling, making that more understandable, accessible, having a consistent definition of what healthy means and an updated definition of what healthy means, creating healthier food environments so that making the healthy choice the easy choice, and then increasing nutrition education for society. You can go to the next slide. So the last two pillars, the first one focuses on physical activity, and as it implies, we're thinking about promoting physical activity, particularly thinking about built environments. Are the places where people live, work, play, are they conducive and safe places to have physical activity? And also promoting physical activity education within schools. And then the last pillar is enhancing nutrition and food security research. So really thinking about how we're tailoring research to really measure equity and accurately measure food insecurity or different disparities in health. I think a lot of the folks that we're talking about research is thinking about what are we measuring and what are we looking at as a success in our country. Particularly, I know around food insecurity, a lot of times in the past, we've measured sort of pounds of food or number of people served, but is that really a measure of success in that area? Next slide. So just a few key messages that I kind of took away from the in-person panels and interactions that I had with folks. And from the national strategy, but clearly that food insecurity is directly related to economic security or economic insecurity. The speakers brought this up multiple times, and they really emphasized, their desire to make permanent the expanded child tax credit and how effective that program was at not only reducing food insecurity, but lifting people out of poverty. So, understanding that people getting access to food really is connected to economic issues. The other point was school meals are one of the largest food security programs in the country, and really investing in healthy school meals for all could really ensure that we're investing in our children's health and well-being. And so that's the healthy school meals for all, I think is something that we're going to be talking about in a few minutes, but that was definitely something that kept coming up over and over during the conference, and something that the White House is really interested in pushing forward. Also, your voice and vote matters. I definitely heard from the representatives that they want us or need their constituents to push on them to be able to push these policies and changes through. So they definitely said that they wanted to hear from folks. And also a huge message is this is a whole of society response. So it's not just the federal government that's needed, it's state, local, private, philanthropy, all different levels of society. We need everyone to be involved in this. And so on the next slide, you can go to the next one, Andrew. There has already been a huge response, even before the conference. There was organizations were allowed to go onto the White House website to share commitments that they were willing to make. And to date, just what the White House has on their website, there's been more than $8 billion made in commitments from nonprofits, philanthropy, businesses, public funded entities. And I just included one example on here that was North Carolina specific from Blue Cross Blue Shield, that they are going to launch a 2-year, $3.5 million effort to keep doing the work that they've been doing to grow the food as medicine movement in North Carolina. And I think that is all that I had. So I'll turn it back over to Tamara.
Thank you so much, Mary. That was wonderful to hear from your perspective and to share the overview of what was discussed. Andrew's now going to talk about the impacts from the national strategy on North Carolina specifically and around the nation.
Thank you, Tamara, and thank you, Mary, for that great overview of what it was like to be at the conference and the big picture when it comes to the pillars in the national strategy. As Tamara said earlier, our goal today is to kind of give you a snapshot of things when it comes to the child nutrition angle. This national strategy has like a 44-page briefing document that's full of plans and goals and ideas, and we really wanted to hone in on some specifics to child nutrition. So the first is advancing a pathway to free, healthy school meals for all. And the specific goal listed with that is the Biden-Harris administration will take a major first step by working with Congress to expand access to healthy free school meals for 9 million more children by 2032. We're really excited about this goal. And I think you heard from Mary, that was one of the key messages she took away from being there. You also saw in the remarks from President Biden and Secretary Vilsack that it was one of the highlights of this strategy for them as well. We think it's very exciting. We're going to talk a little bit more about how it can be done here in North Carolina later on, because 2032 we think is maybe a little too far away. We think we can get it done here sooner in North Carolina. Another highlight is expanding summer electronic benefits transfer, or summer EBT, to more children. I think most of us are probably familiar with EBT and the idea of expanding EBT to children during the summer as a way to help get more benefits and more food to them. This is an exciting idea that, especially in North Carolina, where we have so many rural areas, could be a huge benefit. I've heard from other organizations and partners that a lot of people were surprised not to see many mentions in the child nutrition space relating to the summer food service program, especially after how successful the innovations during the pandemic emergency era were. But we know we're going to continue to support that program here in North Carolina. Next is leverage federal nutrition assistance programs to promote healthy habits. This is a broad goal, but of particular interest, I thought, was the USDA advancing a new Healthy Meals Incentive Initiative supported by ARP funding to support schools' efforts to improve the nutritional quality of school meals. You heard again Secretary Vilsack talk about more scratch cooking in schools earlier, and already in September we saw the USDA announce $100 million in funding for rural areas as part of this Healthy Meals Incentive, and it was described as only phase one for this initiative. So we know there's more money and more opportunities to come as part of this. Finally, a ton of elements in this national strategy are going to impact families and children. And there's a lot in this about WIC and SNAP, especially making them easier to access and easier to use. So we could probably spend the next half hour describing some of those plans, but just a few highlights that stood out to me include expanding online shopping, better identifying individuals enrolled in one program who could be enrolled in others, and creating more connections with childcare agencies and subsidy programs. So a lot of exciting potential things coming for WIC and SNAP as part of this strategy. I want to highlight one example of success here in North Carolina since we're bringing up summer EBT, which is the pandemic EBT program that we've had for children over the past 2.5 years, started in March 2020. And as of the start of the month, according to the Department of Human and Health Services, we've served 1.5 million students and young children through this program and issued more than $2 billion in total food benefits. So I think that shows not only that this expanded alternative EBT programs can be a success for children, but it also shows the need that we have in this state and that there's more work to be done and that we need to keep up the fight, so to speak. Another thing that Mary highlighted earlier was the calls to action for a whole of society response. And I was glad she did because I found this really interesting as well. You know, this national strategy briefing lists a lot of federal possibilities, but they really do a nice job of offering some possibilities for state and local governments, nonprofits, and businesses to get involved with these as well. And, you know, the general tone of these kind of calls to action involve increased investment, especially in school food programs, opportunities to foster collaboration. And there's a lot about nutrition education, which I think is exciting for us. And Mary mentioned too that list of different nonprofits and businesses that have made commitments totaling up to $8 billion to contribute to this work. And it really is worth your time, I think, to go find that list. We'll link to it on our website and just scroll through and see the different examples of things that people are planning on doing. It'll really get your gears turning and get the wheels turning with some creative ideas, I think. So as I mentioned earlier, kind of the highlight for us for the rest of the day is going to be this idea of advancing a pathway to free, healthy school meals for all and how that might happen in North Carolina. You heard Secretary Vilsack describe school meals as a key health tool, and we know that it can be a key academic tool as well. So what we're going to do is talk a little bit about the impacts that this plan might have, the opportunities we already have going on in North Carolina, and some of the challenges being faced by child and school nutrition right now, especially with the loss of healthy school meals for all from the pandemic emergency period to this school year. And I think you'll see that some of those challenges are in themselves ultimately opportunities as well. So in a minute, we'll introduce Lynn Harvey from the Department of Public Instruction to start to dig into that. But first, I want to go to another video with Ruth McDowell. She's the Child Nutrition Director from Edgecombe County Schools, and she's also the current president of the School Nutrition Association of North Carolina. So she's going to kind of set the stage with some of these opportunities and challenges that we're looking at in North Carolina.
Kids are provided books, they're provided transportation to schools. So why not feed the kids for free as well? Okay. Like I said, the meals, I think in looking at the whole child, the meals are an important component of that. We need to think about the fact that kids, our school meals may be the only meal that they get all day. We're having to deal with the challenge of staffing issues, with supply chain issues and inflation. Food cost has gone up so high. Some of my products have doubled in price, tripled in some cases that we're having to implement. Yes, we have a small amount of higher reimbursement. Hopefully reauthorization is going to give us a little bit more money on that side too. But these are issues that we're having to contend with, right now. We're also, some districts are now, we are CEP, so except for our early college. So we don't have a problem with meal debt accumulating. But across the state, I hear that all the time, how debt is rising, among the students. So, that's a big issue with them. Also, participation has decreased across the state because, the kids can't, if they're not filling out applications, or I think about equity in that, okay? I just want to emphasize the importance of the reauthorization, approving the reauthorization as it stands now. And that would include expanding CEP. But the biggest thing, I still think we will continue the fight for universal free breakfast and lunch for all students. What's keeping me going is the fact that my team, they are doing everything. They are in it for the long haul. We are a resilient people. And they know that we are here to feed kids. That's our ultimate goal. And I think if you're in child nutrition, you can't just be in it for the job. You got to have a heart for it. And I think that's what our workers have, is a heart for the program. So we're going to be resilient and do whatever we need to do to make sure our children are fed.
Ruth McDowell gives us a powerful snapshot of what's happening realistically in rural North Carolina. Edgecombe County is an area with tremendous need, and Ruth is there. As she said, she's there in spirit, she's there in power, she's in force with her nutrition team, and that nutrition team power is replicated in all the school districts around North Carolina. And here to give a first-hand perspective of what's really happening in those districts is the leader, Dr. Lynn Harvey. She's Senior Director of the Office of School Nutrition, Office of District Operations at the North Carolina Department of Public Instruction. She really doesn't need an introduction for many people. She has been our partner since the day we formed No Kid Hungry North Carolina back in 2011. And she's been there for years beyond that. She is a national champion as well as a state jewel to us. She leads the efforts to make sure that kids are nourished daily with healthy meals that follow national guidelines that are identified so that children make sure that those meals are continuously healthy and able to provide what children need. She works across all 100 counties with all the school districts in the state. And these school districts, I just want to remind you, are the largest restaurants ever. Imagine serving 150,000 meals a day. Imagine serving 50,000 meals a day. Imagine any thousands and thousands of meals. And that's what these child nutrition directors are charged with doing, and their cafeteria managers and their cafeteria staff. And we honor them and we thank them for all that they do. And Dr. Harvey, please share more with us.
Thank you, Tamara, and good afternoon, everyone. It is my privilege to join you today. I'm always excited to have the opportunity. Please excuse me. I'm always excited to have the opportunity to join you to talk about issues related to school nutrition, topic which is near and dear to our hearts. We know that. I want to thank our colleagues at the Carolina Hunger Institute for bringing together this discussion today. It's so important that we keep the momentum from the White House conference going. And I'd like to capture the words from our president, and that is the most valuable resource in creating the momentum that we need to go forward is you. It's each of us doing all we can to advocate and inform others about these programs. Like Mary earlier, and by the way, Mary, thank you so much for representing North Carolina at the conference. I'm so pleased to know that you were in the mix, that you could feel the momentum and the excitement around what's about to take place. But as I reflected on the 1969 White House Conference, 53 years ago was the first event that we held, I'm drawn to the fact and to the hope that much of the work that came from that conference took place in the first 2 years after the conference. Now, certainly there were periods of time where there were spurts in the energy around issues related to nutrition security. But those first 2 years were critical in getting some of the priorities off the ground. I think that's something that we can think about as we begin to try to do our part to close that gap of 9 million plus eligible students who may participate in meals at no cost for all students. We do think there's a great momentum around this issue, and it takes all of us in informing and educating our various stakeholder groups to bring about that kind of momentum. As we look at reauthorization, child nutrition reauthorization, we know that reauthorization is now 7 years overdue. It's time that we begin to look at reauthorization. I'm happy to see the movement at the federal level. We know that the Healthy Meals, Healthy Kids Act, which is also referred to as HR 8450, that's HR 8450, if you'd like to look more closely, has received its first hearing by the House Education and Workforce Committee, or House Education and Labor Committee, as it's often referenced. And in that period of time, it has received a favorable hearing from this first committee. It's now ready to go to the House for its first open chamber hearing. Ideally, it will clear the House as it is written, and that's going to be very important for us to all preserve what's written in reauthorization. I'll get to that in just a moment. Hopefully, it will clear the House, where it will then proceed to the Senate Agriculture Committee. And once heard in that particular committee, ideally, we'll proceed to the Senate, at which time we should hope, again, to have a favorable vote to move forward. Now, there are some key provisions in reauthorization as it is currently written that will have a tremendously positive impact on school meals. Andrew mentioned some of these a little earlier, but I just want to recap a few that are going to be very important for us, not only to celebrate that they're in the document at this time, but we've got to work really hard to keep them there, which means these topics we're about to discuss are topics not just for us inside the school nutrition and hunger prevention community. We need to have really loud voices to share with all of our stakeholders the importance of preserving what's in that reauthorization bill right now. One of the first things that I am most excited about is lowering the eligibility threshold from 40% of identified students to 25% identified students. As you know, currently in calculating our ISPs, only those districts or schools that have 40% or more students who are identified as being economically disadvantaged are eligible to participate in the CEP. So lowering that standard to 25% will open the gate to allow more economically disadvantaged students to participate. The other thing that is extremely positive about the community eligibility provision, and if those of you who have done CEP calculations, you see the value here, we'll now go from a multiplier of 1.6 up to 2.5. This means that if your district meets the 40% of identified students, you now use the 2.5 multiplier, and all meals are provided in that school and or district, whichever you choose to exercise at that time. All meals are provided at no cost. The reimbursement is at the full federal rate, which is critical as we're looking at a time where food prices, fuel prices, et cetera, all the factors are influencing the cost of meals that we're serving to children. And of course, let's also add the importance of making sure those meals are nutritious and appealing. Those costs are going to be higher. So we're going to need to maintain that revenue. And of course, creating that statewide community eligibility option, which may also be available to us as we look at our numbers of students who are economically disadvantaged are increasing monthly. We'll also, as Andrew mentioned earlier, look at expansions for summer meal security, food security, by providing an EBT benefit for students in the summer. We're looking at what that might look like in our state at this time. And of course, our success, our robust success, thanks to our partnership with the Department of Health and Human Services in meeting PEBT goals, is a reflection of what that need is like in North Carolina. We're also interested in seeing an increase in the reimbursement rate across the board for lunches served to students, along with the potential for increases in commodities that are made available, not just in the lunch program, but the breakfast program as well. There are additional incentives to expand school meal menu items and many, many more. Plus, the one thing we're all looking for is the opportunity to simplify and streamline the existing regulations in the school nutrition programs. I might also add that the Farm Bill is up for reauthorization and reconsideration this year. The current Farm Bill expires in September of 2023. This will very likely impact commodities that are available to our programs, and it may as well provide some other surprises that could await us in the nutrition environment. So as we now move away from the federal landscape, let's take a look at what might be happening with other opportunities that are available to us. I am so proud to tell you that our Superintendent of Public Instruction, Catherine Truitt, has always been, since the minute she came on board, certainly before that, a strong advocate for a strong school meal program. And as she was developing her plan for success in helping to address the long-term forward-thinking goals to transform education in North Carolina, she knew the importance of school meals in that mix. And as a result, in the formation of her Operation Polaris, she established a goal for school meals for all, again, at no cost for families. She wants to start by focusing on students in K-5 and achieve that goal by 2025. So we continue to work aggressively in the department to help bring that goal to fruition. Now, this, of course, is along with our other goals around literacy, around human capital, around accountability and testing. I think it speaks volumes when she says that one of our top goals will continue to be to strive for those meals at no cost. So the next area that we are so pleased to hear about, you may recall that when the Healthy Kids Act was passed in June, unfortunately, the Senate made the decision to remove the support for the reduced price copay. In the 12th hour, we reached out to the North Carolina General Assembly and said, hey, we need your support. We need to make sure that the student copay for reduced price meals is made available to our students in North Carolina, because it was very quickly, abruptly removed from the federal language. And I'm so proud to say that our policymakers in the General Assembly heard our request and responded quickly by appropriating $3.9 million to take care of the student copay for reduced price meals. Now, it's important to recognize that this is not a recurring provision. This was a one-time authorization, and justifiably so. We asked for it in the 12th hour, so to speak. So we want to make sure that we keep our policymakers informed of how important that 3.9 million is in helping our economically distressed families, those who qualify for reduced price meals, have meals at no cost. I'm also happy to say that the Department of Public Instruction was able to receive a Medicaid direct certification grant. And as a part of that project, if you will, we are now directly certifying students for free and reduced price meals based upon their participation in Medicaid programs. Happy to report that as of this month, we have certified 261,000 plus students for free meals based upon their Medicaid enrollment. And for reduced price meals, we've been able to certify 8,979 students. So that alone is increasing the number of children and families who are eligible for meals at no cost. Again, a huge step forward. I will remind you, as you're talking about and learning more about the direct certification with Medicaid project, that we understand that this does not apply to all Medicaid programs. So it's quite possible that a household can be eligible for Medicaid programs, but not eligible for direct certification through Medicaid. Just an importance to denote here, so that we can ensure that we're giving accurate information when we talk about this. But again, the figures are very impressive. Now, of course, with the community eligibility provision, we are continuing to see some changes in CEP, as many districts are now having to consider recertification. For those of you who are representing your districts today, your counties in the south, north, well, the southern part of the state, particularly the areas that are prone to natural disasters like hurricanes. We know that period of time where we seem to have one natural disaster after another, that condition enabled us to receive disaster SNAP benefits. And it's that eligibility that increased our ability and our capacity to qualify for the CEP. Now, thank goodness we've not had a natural disaster in a long time, and I literally am knocking wood. I hope you hear that we don't have one of those disasters in the future. But we're going to see some districts that may no longer qualify for CEP having lost that particular disaster status. That's going to be something that we're concerned about as well. Something else to consider, just next week, I will be reporting to the North Carolina State Board of Education, addressing issues related to their strategic plan. You may be surprised to know that our State Board of Education as well sees, as they always have, the importance of healthy school meals as a part of the students' opportunity for a sound basic education. One of their priorities is to continue to increase the number of schools and districts using innovative breakfast after the bell programs, summer meal programs, at-risk after-school programs, in order to help make certain that our students are well nourished and ready to learn. So we'll be reporting next week to them about our work in that area and where we've seen program growth. Hats off to all of you who have made breakfast after the bell a priority, who have made at-risk after-school meals a priority, because we know that this gives the wraparound we need to make certain that our students are well nourished breakfast, lunch, and toward the end of the day. In addition to the state board's strategic plan, next slide, please. We do want to talk about some of the challenges that are facing our programs. We would be remiss if we didn't talk about the statewide staffing issue that continues to persist. as it is challenging to have adequate staff to do some of the kind of innovative programming that we'd like to do. Again, accolades to school nutrition directors and school nutrition personnel who are really rolling up their sleeves, getting in there every day to make certain that we provide the most nutritious, appealing, affordable meals to every child in the district. Despite those staffing challenges, supply chain issues continue to persist. We may not always we may have to change our menus at a moment's notice based upon what's available to us. That sometimes, as Ruth mentioned earlier, that may impact student participation if students are expecting one particular item only to find another. Inflation. I don't have to tell anyone the impact of inflation because it is affecting every one of us every day. Food costs, fuel costs, housing costs. It seems like the cost of everything is going up at this point, and that's impacting families' ability to pay for meals. It's also impacting the cost of those meals. But an item that is emerging literally as I speak with you today is the concern around growing school meal debt. As of about an hour ago, I'm looking at communications coming in from our local school nutrition directors, and with 90 public school districts reporting, we are just at $1 million in school meal debt as of today. That's an unprecedented amount of school meal debt, and it's become quite the source of conversation among local boards of education who will find themselves having to be responsible for that meal debt because, as we know, federal school nutrition programs may not absorb debt of any kind. So this is going to be something that we'll continue to monitor. We have voluntarily agreed to report on school meal debt to our decision makers in the General Assembly so they may be cognizant of what's happening and how that meal debt is impacting students, first and foremost, families, communities, and local schools, as often the funds to pay school meal debt will be coming from general education funds. Relative to income guidelines, we also have to be aware of the fact that there's a misperception that sometimes that school meal debt is a result of households who simply don't complete the household application. We're now recognizing that's not the case. We have households who are unable to qualify for free or reduced price meals. I spoke with a school nutrition director just yesterday who said it was the most painful thing to have to deny a family because they were just $100 off the income guidelines to qualify for reduced price meals. And unfortunately, they did not qualify. So the guidelines are something that may need some adjustment as we move forward. And of course, as mentioned previously, the CEP statuses that are tied to natural disasters. We are deeply concerned that some of our districts are going to lose that, at least if not at the district level, at the school level, to function as full CEP eligible schools. That's going to be something that we're going to work with each school district to determine what the best mix and best combination of combined schools will yield to help them generate the maximum resources available. So as we wrap up the what's happening in the landscape, I do want to reflect on the theme of the conference. I was really pleased to hear when it was announced earlier that we're talking about policies, because we know we're driven by policy. We're talking about prospects, what that means for us for in the future. The future looks good. We just need to seize the opportunities to make it shine. And then the last was around possibilities. These things are within our grasp. But a couple of things that I would suggest that as we move forward, we must remember we've got to change the language around school meals. We've been conditioned as a society to often think of school meals as a sort of a welfare state. That's not the case at all. School meals, as we all know, I realize I'm the proverbial preaching to the choir here. School meals are instructional interventions. As Ruth mentioned earlier, school meals are like transportation to and from school. School meals are like digital devices that children now need in order to keep pace with a fast-moving education environment. They're like any of the other resources that we provide to students to make sure they have our best so they can do their best. So I want to encourage you, as you have conversations with your stakeholders, school meals are instructional interventions. They are a clear part of the instructional day. And then first, certainly last and not least, please don't be afraid to use your voice to tell this important story. Make sure all who are involved in your school district, your superintendents, your board members, your key community stakeholders, businesses, anyone who can speak out on our behalf relative to the students' need for nutritious meals will be important in this conversation. And keep in mind, the message is not just about let's get reauthorization for school meal programs as quickly as we can. Let's make sure the language in reauthorization that is there now stays, because that's where we have the greatest protection when it comes to supporting the CEP and ultimately in achieving our goals of meals for all at no cost. So with that in mind, I'm going to turn it back over to Tamara. Thank you again, Tamara, for the opportunity to give that high-level overview of what's happening in North Carolina. And thanks to each of you for being active advocates to inform your stakeholders about what's happening in the school nutrition environment.
Wow. Wow, that is remarkable. And so much innovation in North Carolina. North Carolina certainly is not shy about expressing our needs and looking for solutions. And I hear that loud and clear, that meals are key as an instructional intervention. And that's a message we all need to share and we all need to think about. Because if your little Susie is sitting in a classroom and can't learn because the child next to her is hungry, there's going to be behavioral issues, there's going to be so many issues, but not only is it unfair to Susie, it's so unfair to that child who can't learn. So let's make sure that we give them the tools in the toolbox that are available to us, and we know that nutrition is such a critical intervention. Next, we're going to see a couple of videos, and I just thank you, Lynn, so much for sharing that. But we're going to go back to the national conference and hear from a real leader in national child nutrition as well, Donna Martin, who's the director of school nutrition programs in Burke County in Georgia. And she had some pretty powerful things to say. And then after that, we're going to hear more about school meals for all.
It is not hard. Universal school meals, universal school meals, universal school meals. Or what I like to call healthy school meals for all. These meals are based on the dietary guidelines. We know by research they're the healthiest meals in America for children to eat. And by offering this, we would cut out the stigma, we'd cut out the lunch debt, no teachers would be hounding the kids, no managers would be calling up those parents. No manager on the line would be taking the tray away from Johnny, his favorite meal of spaghetti, and giving him a bologna sandwich. So that would take all of that away. So I'd like to say that Healthy School Meals for All is not a food security program, but a nutrition security program. This is our opportunity to teach kids how to eat healthy, and guess who they're going to go home and teach? They're going to teach their parents how to eat healthy. School meals are a very important part of the meal day, guys. It's just like having books, transportation, teaching. Why do we ask people to pay for school meals when we don't ask them to pay for those things? If you can afford to pay for school meals, they say you should have to pay for them. Well, if you can afford to pay for school meals, you can afford to pay for your books and stuff, but we don't ask people to do that. The last thing is that we know that Healthy School Meals for All will improve health, improve academics, and support local agriculture. And we have this moonshot opportunity to do this, and listening to Biden and Vilsack, it sounds like they're on the same page. So let's go for it. Our kids are worth it, and we can do this together, guys.
Hi everyone, I'm Katie Herndon-Dawkins, the Communications Manager for the North Carolina Alliance for Health. We're excited to officially invite you to learn more and become part of our School Meals for All campaign. With the Carolina Hunger Initiative, the Center for Black Health and Equity, A Better Chance, A Better Community, and partners like you across the state, we will work to secure funding for School Meals for All so that every child in every public school has access to breakfast and lunch at no cost to their families. We know that kids who eat healthy school meals do better in school. The National Strategy on Hunger, Nutrition, and Health includes School Meals for All, and we think this is a huge victory. However, the strategy doesn't push for healthy school meals for all right now. And that is why a School Meals for All campaign in North Carolina is incredibly important. We hope you'll sign up for more information and join us on November the 14th at 1 p.m. via Zoom for our School Meals for All Coalition meeting.
Thank you, Katie, for sharing that message. And we are excited that there is an opportunity for you to sign up at the North Carolina Alliance for Health.org/school meals for all. There is an important meeting coming up that Katie just announced, and we hope that you'll be able to join us. We're Carolina Hunger Initiative is honored to be part of this. We're so incredibly honored that Blue Cross Blue Shield of North Carolina Foundation is making this a priority, and we're working with these powerful other organizations to see where this program can go in North Carolina. We've heard the need, and now let's put action behind that opportunity. Andrew has shared the, Andrew, I understand, has shared the address in the conversation for everyone in the chat feature, and just hope that you'll make sure and go there and sign up and learn about what's happening. Words without action are just words, and we know that the real meaning has to happen when we take steps to make a difference. And so we hope you'll pay close attention to these action steps and think about, what can I as an individual do to make a difference in the lives of these thousands of North Carolina children? And as a reminder, please do sign up for the School Meals for All campaign. And remember, the most powerful thing that you can do related to these policies, related to the hope for these children, related to the opportunities, is to go and vote. Early voting is happening now in North Carolina, and you can Google 1,000 ways to find out what you need to do to plan your vote and how you can go and express your vote. There's an opportunity. You can find resources for all the above, and I want to direct you at the bottom of the screen where there's an informative articles from educationnc.org that tells the perspective of the majority of the candidates on how they feel about education, and the impact that nutrition has on education is something that's so critically important. I also encourage you to share your story. Parents, if you have an experience, a lived experience, please share that. You can also advocate for school meals in your school and your community through your PTAs, school board meetings. Many, many new school board members will be coming on with this election coming up on November 8th, and they would need to be informed about what's happening in nutrition in their schools. The school health advisory councils, that's a meaningful way. And then there are local school wellness policies and wellness organizations outside of the school advisory councils. We just encourage you to get the word out and help be part of the solution. School nutrition teams are going to practice leading up by sharing with district leadership how school meals are an instructional intervention. And if you're part of a school nutrition team, you have a powerful voice. Make sure they are informed about what's at stake. They need to know firsthand how it's going to impact their communities that they are elected to serve, that they are appointed to serve. You can find resources for the above, plus links to the White House conference recordings and strategy documents, and lots more on the Carolina Hunger Initiative website. Please go and explore and find out more and speak up. Thank you for being here today, and we're honored that you spent your time with us, and encourage you to, the recording will be available afterwards and online on our website, and we hope that you'll share it with others. Thank you for being here today.
There is more than enough healthy food for everyone. The truth is that food brings us together across the lines of ideology, geography, race, and culture that too often is dividing us. And this is not a choice between red and blue America, between rural and urban America, between children and seniors, between natural born and immigrants. Let me remind you all that today is not the end of this effort. It is the beginning. It's the launching pad for your great ideas, for all the great ideas that are going to come from here today. And it's a call for action. We need to write new recipes to feed a hungry nation and build longer tables so everybody can eat from the goodness of this American farmland of ours.
There's a lot of talk about how academics with COVID learning loss as a focus. But before we get there, we have to take care of our children and their nutritional state. There's a gap where kids now, since we are not receiving universal breakfast and lunch, that they're coming in hungry and less focused, and they're worried more about where their next meal is coming from and less about what reading or math is in front of them. So I think that Meals for All would greatly benefit all of North Carolina, my students and all 1.5 million students in North Carolina. It gives every child a chance to focus on school and not focus on where their next meal is coming from. What we do in education is we remove barriers to allow kids to learn. And this is an easy barrier that we can take away from students to allow them to focus on the academics piece of school.
For many of our kids, that's probably one of the most healthy meals they're going to get throughout their day. And so it's really important that it not be shoved to the wayside and it be a priority for school leaders to advocate for healthy meals for our kids in the morning and the afternoons, and supporting all kids, because all kids deserve healthy meals here. What we're seeing this year is a tremendous drop-off in lunch participation. And it really goes back to that universal benefit of all children having access to healthy meals. And here we are now at North Henderson High School in Apple Valley. We're serving 300 less students a day, which is gut-wrenching to me. And a lot of that process has to come with students who have never filled out a free and reduced lunch application form or don't have the ability to. Compared to pre-COVID, at this point in the year, we're definitely seeing a tremendous uptick in school meal debt at North Henderson High School. Those debts are going to increase because we're going to feed kids, right? No student's going to leave North Henderson High School or any school in Henderson County and not be fed a meal. And sometimes what we're seeing in the majority of these cases is that debt falls back onto the schools and the school districts. And I know that's been felt across North Carolina is how do we solve these school meal debt issues. I can think about my own son. He's at 7th grade at Apple Valley. I think he eats 3 meals before he gets here and starts school. And that kid can't stop eating as a 7th grade boy. And so going into the classroom with a rigorous course of study, students are learning on a block schedule. They're introduced 4 90-minute periods, lots of concentration, lots of expectations on them. And we got to support those students. I think there would be a definite benefit to a universal access to healthy meals for all kids. You know, what a powerful equity component it would be. It would really just take away the stigma, which is honestly what I heard from kids. You know, we talk about student voice. That's important at North Henderson High School. And the ability for kids to drop the stigma and everyone receive a healthy meal and sit down and not have to approach a lunch line and say, do I have money in my account? Did my parents remember to do that? And so I think universal access would be tremendous for North Carolina. I think it would be tremendous for all kids. But at the minimum, I think there has to be an increase in that family threshold, that income level. And I think that would help collect a lot of those bubble students back into the fold. It should be a focus of all school leaders right now to ensure that our students are able to have healthy meals at schools. And I think we have the ability to do that. And so I just want to encourage my colleagues to make sure we're advocating on the local, state, and federal levels so that our students have the ability to receive nutritious meals.